Hi, I'm Tom Wright, and
Dr. Joe Jenkins.
And we're here at the American College of Phlebology, their annual congress in Austin. And can you tell me, Dr. Jenkins, what have you found interesting at the conference this year?
Well, for me, I love the networking. Okay, I'm basically with the hearing problem stuff. I really have problems to get CME and stuff. So to sit in the conference room and stuff to listen to lectures and stuff, it just doesn't work for me. But so I usually buy the content at the end and do it in my office type thing to get the CME credit. But it's the networking, learning, seeing bright, excited, new individuals that are members and stuff, and going, hey, why do you have all these buttons, and how do I get those certifications type thing, and going, well, let me tell you. And so it's trying to instill in new docs that really have a passion to do vein care, how to do it correctly.
That's great. That's great. So you've met a lot of new, enthusiastic doctors.
I can think of at least 10 that I've talked to.
Yeah.
And I've also met the physicians that have been members, and they seem to be really passionate. And it's like, oh, hey, we need you to come on as an active member.
Right.
Come join a committee and stuff. I'd love you on my committees and stuff. I've been changed just at this meeting to a new role and stuff. It'll actually be a small committee because I'm in charge of the operations portion of the vein registry. So, if just very selected individuals on that, because we don't need a huge big committee. But
right.
Before that, I was on the Endearing Materials Committee's online CME. We did all the review of the course content that was offered online coming out of this Congress, past Congresses and stuff, to make sure that it met the requirements for ACCME criteria, and so that it was appropriate. And that's a lot of time commitment, and people that, if they want to be active, would have been a great place to put new people. So I know there's been some restructurings with committees during this meeting and stuff, but there's always an opportunity if somebody really is passionate about it, they can really get into, come on aboard, we need your help.
Okay, so Dr. Jenkins, just if you could, you got 30 seconds in an elevator to tell me why I should participate in the case of the month.
Oh, the case of the month came out of my Leadership Academy requirement and stuff. It is awesome. This has been going on for 2.5 years now. We haven't quite hit every month, but really have heard from people that are doing it and stuff going, wow, we love that. We get a half an hour worth of CME, and I actually learned something. From reviewing just a short little case, and then there's the discussion, which usually has then been researched in the literature and stuff to give support of how to do the treatment or why was this appropriate.
So it really gives an opportunity for vein doctors in the community like myself and you to keep up to date in small, frequent feedings of new information and new studies.
Correct, and I will just, as a little tidbit, the newest one that's going to be coming out is a case of mine that has to deal with an individual that has lidocaine intolerance, and going through and stuff, and it's how it's developed is there's actually a genetic abnormality that could account for it in people who have red hair. So I'm just trying to throw that out there to, hey, go out and take a look at it.
That's interesting. So we'll have to keep an eye out for that. And then I understand there's going to be a case of the month coming up about lipedema.
That's correct, and I'm excited about that. I'm seeing more and more patients in my practice with lipedema, and the bottom line is I myself don't know where to refer those people to get the appropriate care.
It's true, Dr. Jenkins. There's a lack of awareness and a lack of places to go for lipedema patients seeking treatment.
Correct, and it's, some that I've seen and stuff basically have gone down a path of actually having their veins treated and didn't get any improvement.
We're finding there are a lot of lipedema patients that do have superficial veins. We're still not sure that those superficial veins are responsible for the majority of their symptoms.
Right, and that's the part that it's like, just because they've got some veins doesn't mean they need to be treated. The veins need to be treated. You really need to take a look at the patient and what's causing their symptoms, and is there something you can do to improve their symptoms.
Well said, Dr. Jenkins.